You ready, Andy? Good afternoon. We're ready to start the October monthly Budget Committee meeting. We have a busy agenda, and so I welcome again our Budget Committee members, Leslie Moriarty, Jeff Raymer, and Andy Deuce. And we are, as in last month, we're back meeting normally, except socially distanced and with masks, obviously apparent. So we will begin our agenda today with the Conservation Commission request for an additional appropriation for the mural for $25,015. And we welcome Pat Sesto from the Conservation Department, who looks like she had some accident or something. And this is the mural application that I believe was a gift approved by the RTM last month.
Yes, that is correct.
So Pat, welcome.
Thank you. Pleasure to be here and thank you for the message. So we went through the RTM process to receive the $25,000 to then go ahead and implement the mural project, and that consists of the mural for $13,875, and then moving the bus shelter is the next. Yeah, thank you. So the mural for $13,875, moving of the bus shelter is the next biggest expense at $5,340, and then other expenses in association, including educational material as well as a demonstration pollinator garden. So all of these, we would receive the money from the Botanical Center, and then the commission would contract and execute the project.
Thank you. Do we have any questions? Leslie?
I just want to clarify, because this project has been through just a few meetings, I think. And the reason that it's coming before us, even after RTM approval, is because when we get a gift of cash, that we need an appropriation to be able to spend the cash. And that's, I think, the reason for here. It does not need other than BET approval for this appropriation. And I want to confirm that that's all that's required at this point.
I follow your lead because this is
Right.
fun.
So the law department or the RTM has confirmed it does not go back? Is that what
But
you're?
they've already appropriated. They already approved the appropriation. It's just
No,
the sequence got reversed.
I didn't know that. I knew they approved the gift, but the last I heard, there was some discussion on whether there was no mention in that particular approval about a cash appropriation. So I'm just asking the question. Jeff?
Yeah, I posed that question to the law department. I have not heard back.
Okay, you haven't heard back. Okay, thank you.
That would be you'd hate to have the RTM members have to waste their time to go through something they've already.
Anyway, you're here and that's the appropriate thing to do.
That's my
And,
hope, yes.
Quite frankly, it's already been there, so that would be my opinion, but that's, my opinion doesn't value. Leslie, I'm
So
sorry.
I'm happy to
make.
make, no, I'm happy to make the motion now if
Oh,
all.
can I just ask Andy or Jeff if they have any questions? Andy?
Well,
Has Andy-
we can discuss now or after the motion's made, but since I have the floor, do we have a contract for the 13,000 part of the expenditure?
So I have a statement of work from Nelson Rivas, who is the artist. That will be reviewed and approved by law department. We're waiting on his liability coverage and other supporting documentation. So I'm fully connected with law and risk management to be sure that before I sign, we're in good standing.
And as part of the contract, is there a copy? The images, I think, have evolved. Is there a copy of what's going to be ultimately up on the wall?
Yes, it is. There is, as
Okay.
part of his statement of work, there is that image that he will be painting.
Okay. I would guess we could certainly approve this, but it has to be subject to approval by the law department. I mean, because they haven't passed on the contract yet, have they?
They have not, no.
Yeah.
So I don't know how that works with you all, but I don't know the coordination between those two. But I'm fully aware that they've got to give it their
Right.
blessing before I go sign on the town's behalf, for sure.
We normally here appropriate funds, and then they contract it out, and the law department approves it. We don't generally appropriate funds subject to the law department approving. So, I mean, I think for us just to approve the funds without a condition for that would be in line with what we typically do, Andy.
So may I ask you a question, Jeff? Sometimes we approve, approve the appropriation without necessarily a release of conditions, but we do make some kind of further comment that, say that together with, that we expect prior to the release of the funds, that that there'll be a contract with indemnification insurance signed off by the law department or something, without necessarily having it come back with a condition? Is there something like that? You're very good at crafting things like that.
I'm not sure I am, but I just don't think it's necessary. I don't object to your doing that. If it would make you feel more comfortable, I'd even support that. But I honestly don't think it's necessary. I think in line with what we do, we're appropriating funds for a contract, and at that point, they sit down with the contractor and review his insurance and review the form of his contract and quibble over whether or not should be this indemnification clause or not. This type of thing, all that is out of our purview and takes place after we've approved the appropriation.
Since there's been some discussion about this, is there some language that you could just, well, I guess we don't have a motion yet, do we? Or you were making a motion?
No, Leslie
is making a
Mrs.
motion.
Moriarty was poised to make the motion a moment ago.
I was just going to make a motion to approve the additional appropriation of $25,015.
And I would second that motion if that's the motion that's just been made.
Okay. And so, again, to, follow up on what Andy has said, I've asked, can we have an additional sentence that just, comments on a document supported by the law department with indemnification or something? Insurance?
Yeah,
You want to
I mean-
write it, you want to just give me a few words?
I mean, I think the few words are just window dressing, unless you want it to be a condition.
No, I don't think we need a condition. I think
right.
sometimes we do things that,
Approved with the expectation that that the contract documents and related materials will be approved by the law department. Says I am making something up.
Andy, is that okay with you? Is that fit with what you had in mind?
I think that's good. I also think it's helpful, given some of the history here, just to have that additional clarity added to our approval today. Thank you, Jeff.
Okay. So shall I take a vote? Leslie?
I'm voting in favor. I just want to make the comment that I think typically we expect our department managers to comply with requests from the law department, so I really don't find that added phrase necessary, but if it's there, I still support the appropriation.
Okay. Jeff?
Voting aye.
Andy?
Yes.
And I'm a yes. So that has passed 4-0-0, Pat.
Right.
Thank you
So
very
thank you.
much.
I'm sorry.
Oh, I'm sorry. Did we say routine or non-routine?
I would propose to you that it be routine, and the wording of the motion should be that we recommend the approval of it to the full BET.
Okay. So Pat, it's unlikely that you will have to come to the BET meeting, but just follow the agenda in case the chair decides that,
Absolutely. There's been nothing
if it's
normal about this.
that it's a non-routine item. So anyway.
Okay. Thank you very
Thank you so
much.
much. Thank you for coming.
Thank you.
Sorry about your walking cast.
What happened? Or is it none of our business?
I missed the bottom stair, take the dog out.
Sorry about that. So now we have the health department. So we welcome the health department and Caroline Baisley. And Caroline, are you, or who is going to talk to us? We have two items on our agenda from the health department. We have an approval to use the ELC COVID-19 grant, and then we have HD2, an approval to use PHEP grant. I will say you're great at getting grants, Caroline, so thank you very much. So let's take the first one.
Okay, the ELC grant, this is a part of the COVID-19 public health dispersion money from the federal government. They combined this year and the third year. It was a 3-year contract. So the first year is behind us, thankfully. This year would be $115,597, and then the third year would be $57,799, and that's where you're getting the $173,396. So they decided to combine year 2 and year 3. At the end of December of next year, 2022, anything that's not spent out of the money that you're looking at today will be sent back to the state of Connecticut via the state and back to the federal government, I suppose. Okay, so the amount, the state of Connecticut has approved this application. What I've given you, we've outlined a few items under the personal services category for $124,379.73. We have a public health educator, and Dr. Stephanie Palmino will be the educator for the department. She has will be placed in this COVID-19 account to do specialized work for COVID-19. We also have a part-time public health nurse that will work up to 14 hours a week, or it says 7.7 hours, or up to, it can't be any more than 14, according to the HR department. And then we have a part-time contact tracer also in there. We haven't had any luck in the past to get contact tracers for hire, actually. I've gotten a lot of volunteers who will do it for free, but I do have this position in there as well. We also have professional services. One of the doctors in the community has been very gracious to, we haven't signed a contract yet, it will be a small, short contract, they call it under $5,000, that would provide services of testing those specialized at-risk community members, folks that would be in adult daycare or some of the daycare centers or pathways. Should there be an outbreak, we will be able to get them tested right away. And so this really covers the service of the medical provider, the supplies, and, you know, overseeing the actual results, processing the results of the COVID-19 test right away so that they can be able to be, you know, tested without waiting. Overtime services for the department staff, that came in very handy last year. All of our expenses are covered by the federal government that we're not only doing for COVID-19, but also influenza. And then some supplies that we needed or will need for our boostering program and our initial COVID-19 vaccination program have been placed in this grant so that it doesn't come out of the town's forfeitures. And one of the things that we have also in here is some mobile phones. I call them throwaway phones, but they're phones that you can purchase with some minutes on them to be used by the contact tracer. We've also given some of the phones out to the contract tracers that need phones that have offered to do this for free as well. And then office supplies. We go through a lot of office supplies, as you can imagine. We do poster boarding, we have signs. Just, it's unbelievable. I don't know what else we have listed in there. Markers. Huh? staplers. We go through staplers like crazy. We do have a copier that needs to be downstairs. A lot of people that are coming in and getting not only boosters, but the initial immunization, because of their jobs, they need copies of the actual paperwork that we actually give them. A lot of people don't bring their cards, unfortunately. So we have to either make out a new card, or we have another kind of slip that we use to designate that they had gotten the booster. Because cards are being sent by the federal government, and you're not supposed to really duplicate them, because that's considered fraudulent. What I did was I made copies of my work plan that was submitted to the state. I thought it'd be easier, perhaps maybe you can ask some questions from it, but this outline is exactly what our deliverables will be to the state. And again, what I submitted in my application is an overall program plan that they give you to choose from. And what I've chosen is what I'm going to give you today. And you can see what our actual work plan will be, that we have to submit deliverables on a quarterly basis to the state. I broke my foot, my toe.
Oh, my goodness. Is this going to happen all for the rest of the afternoon? Everyone who steps over to that table has got an injury? So while you're doing this, Caroline, we just really have to thank you for all the work you've done throughout this COVID environment. It's been, a long haul, well over a year and a half, and all the contract tracing that you and department, and all your volunteers have done, and everything to, obviously your clinics and even the flu clinic, it's all balancing out now. So, thank you very much for doing that.
The good news is some of the cases are starting to go down. Health officials believe that the Delta variant has reached its capacity in the United States, but also it's a little worrisome that perhaps maybe from the Delta variant will spin off another kind of variant, because there's only 56% of the United States population that is vaccinated. So we're hopeful that that doesn't happen. They also believe, as we believe, that we will see a surge, hopefully not wave number 5 of the pandemic, but rather just a surge as cold weather hits and everyone comes indoors and, there's more gathering. So we're hopeful that it will only be a surge and not another wave, which would be wave 5.
Well, we hope so too. So do we have any questions for Caroline about this one? Do we want to separate them, and since they're two different topics, and just
I'm sorry.
have a motion on this one, or?
I had a question for Roland. Can I ask a question for Roland? Is that right? Yeah.
Of course.
Roland, I don't know, I never paid attention to it before, but it happens quite often, each year pretty much, that Caroline comes in and she's received a grant for some part-time assistance or something. In this particular case, maybe it's always been the case, but in this particular case, of course, as Carolyn pointed out, because it's running for 78 and a quarter weeks, it obviously is funding salaries for more than a year. How do we handle that? Because we appropriate salaries for a given year, so we're effectively here appropriating salary dollars that will run past the end of the fiscal year and into the following fiscal year. How does that handle?
These grant funds are multi-year. They don't end at the end of June 30th of any
Right.
given year. So some of these are 2-year grants, like, for example, the Board of Education. Most of those are 2 years, and the appropriation just continues in force until the grant has been spent.
But when we're showing in our budget lines, I mean, these dollars, these salary dollars are picked up there as being salary dollars, and the source of funds are shown as a revenue item, or that's not how it works?
No, these items are not in the budget book.
So that's the issue. That doesn't disrupt then our orderly annual budgeting process. It's simply as a question of there being multi-year grants that are being handled in the books differently.
Yes.
Okay, thank you. That's the only question I have, Madam Chairman. Thank you.
sort of following up on that question, but this is to Caroline. Thank you for the information on this particular grant. In the personnel services, the people that you're hiring, are those all new positions, or are you utilizing existing part-time staff, for example, the public health nurse, and just allocating a portion of those hours into this grant fund and towards this grant?
New hire.
Okay, and you indicated that for a contract tracer, you're budgeting for a contract tracer. You have not been successful in the past at getting someone in that position. Would you then, your intent would be, would you reallocate that $18,000 to other COVID personnel functions?
Actually, we do have a name of a person that inquired through the HR department, so we're hopeful that that person will pan out for us. For reallocation, there's a time frame that the state only takes reallocation requests. So if there is enough time, because this is kind of a short time frame up until December 2022, should we need funding in other categories within this grant, we would ask for reallocation during the time frame that they accept, revisions to the grant. You can't just ask for a revision that, with 169 towns. They don't, they do it very symptomatically. There's only a window or period that you're actually able to ask for any changes in your grant. So if we have an opportunity and we need funding in another part of this grant, we will. But that won't be until next year.
And I noticed that none of these grant funds go towards PP&E or purchases of physical goods like that. You're handling that through other parts of either other grants or your budget?
Oh, PP,
Supplies,
no
sorry.
PPE
Yeah.
in this part of this grant. We did get to do through the crisis grant, we did, and that was the COVID crisis grant, which was last year or the year before that. We did manage to get, some of the, face shields, and because the nurses have to wear face shields and/or goggles and masks, and so we managed to get that. But everything else we wear is more or less, they wear aprons, so we throw those out. We've had those in stock. So we haven't had a need to really, the stuff that we still have is for the doctors, and it seems like when there's a wave, they're in wave, they start to ask for supplies. So we're almost down on the supplies that we have for them, but that was from the region that didn't go through any of the grants.
Thank you. No further questions.
Beth? Right, Caroline, can you give a copy to Roland, and Roland will just circulate it after the meeting? Oh,
Also identify the staff member that's here with us.
Debbie. Debbie Edwards is the business office manager for the Department of Health. I apologize. We haven't had an in-person meeting for such a long time.
it's great to see you. It's great to see you in person. So I just make one comment that these grants also, Caroline, include the town social security that has to be paid, which is what we've asked for in the past, but it's 7.65%. So it's a sizable amount of money, and it covers it.
Yeah.
Do we have a motion to approve this?
I would gladly make a motion to approve this and to recommend its approval by the BET as a routine item.
There's a second?
Andy seconds that motion.
Okay, great. So as routine, and those in favor?
Aye.
Aye. So that vote is 4-0-0. So Caroline, that looks like that's routine, so it looks like you won't have to return next Monday. And why don't you explain HD2 for us, which is another grant in this case, for PHEP.
Public Health Emergency Preparedness Coordinator.
This is the Public Health Emergency Preparedness Grant. Actually, it's been quite routine on the amount of money that we've been getting for this grant over the last couple of years, $43,311. Most of it is salary for the Public Health Emergency Preparedness Coordinator. There is a few dollars set aside. Obviously, we have not only salary, but fringe benefits in with that, but there's also a few dollars, probably around not even $600, some in office supply materials and what's considered drill and exercise supplies, and travel. If we have in-person meetings, he will be traveling to those meetings for this year. I should note that the $15,608, which is budgeted in 401, which is the Department of Health budget, is it is an expense that actually gets paid back through this grant each year when we submit. So it comes right out of the grant. So the town gets reimbursed for that $15,608.
So, do we have any questions, Andy or Leslie, Jeff?
So with the experience that we had, so not to say that you don't have other issues, health issues that come up every single year, certainly flus and the like, but certainly COVID was dramatically at the extreme. I assume in that process you learned some clear lessons of how to handle a really serious life-threatening emergency. Are there changes that you made in the approach from what you learned, the lessons learned type of thing? Or did you feel like the way you'd organize yourself to deal with an emergency was spot on and you wouldn't need to make changes going forward in the future?
Well, for the amount of staff that we had to respond to this emergency, I think the staff did quite well. An emergency like of this sort is a hands-on emergency where there's a lot of contact tracing, a lot of disease management. We did that with almost all 22 full-time people that we had, and some of the MRC volunteers, Medical Reserve Corps volunteers. The pandemic that hit us last April just hammered us. I mean, I think it hammered every health department in the United States, since we're quite light on people and quite light on budgeting and so on and so forth. So it was all in management. The hospital handled their wounded, but this was a pandemic not only hitting in the earlier phases of the pandemic, hitting the hospital with people who had to go to the hospital, but there were also almost 60% of the population that got hit with COVID even then and now, are more so then, not now. It's more now. We have a lot more people recovering from home, which meant that that's public health's responsibility to manage them and to monitor them for 10 days. And to quarantine, I issued quarantine orders, I issued isolation orders that the governor, through the commissioner of health, had given me to make sure that people stayed off the streets and didn't circulate the disease. So, as a seasoned person who's worked for pandemics, I was quite ready for the pandemic, although it was overwhelming to the amount of cases that we had in the beginning. We were doing 150, 225 a week. And even up until this last part of March, we were doing well over 125 cases a week. A lot of cases for a small crew, but they work very diligently, I have to admit. A small team as we were, we never left this building. When this building closed last March, we never left. We occupied this building, and we still, there wasn't days off or anything like that. We worked through and through. In fact, no one of my department had any of this off time, work 2 days, come in 3. It was 5 days worth of work, and up until last year, it was 7 days worth of work. So I think what I'm saying is that we need a lot more people to handle something of this size. Yes, I think the state did over well, but it just, did we miss some stuff? Absolutely. There were times when we could just take as many as we could. 40 cases of pop for each one of us is a lot. But we handled it the best we can. So,
Going forward,
that's the best I can answer the question.
sorry,
What will I do differently?
yes.
What we did was exactly what we're supposed to do with public health. It was just the amount of work that we had to handle was just overwhelming for the amount of people that we had.
Should a health department in a town like Greenwich be maintaining an inventory and storage of masks and gowns against a future event? Is that an advisable thing in your opinion?
Well, we don't go out to the house. You have to remember, this is not on site. This is all through telephone, Zoom. If we have to get somebody to the hospital, we call 911,
No,
and they take them.
No,
So it's not hands-on.
My curiosity is that going back to a conversation that we had in March of 2020, when you happened to be before us on something else, and COVID at that point was just emerging. We hadn't yet gotten to that date in the middle of March when there was the shutdown and the like. And you and I had publicly a conversation talking about the relative unavailability of N95 masks and gowns and the like. And there are first responders who would be needing them. And it did not seem at the time that there was any large supply either in the hands of GEMS or the hospital or the private physicians and the like. It isn't necessarily the responsibility of a town's Department of Public Health to carry an inventory, but I wonder about the advisability of against a future event. It does seem like something which stores well, doesn't spoil on the shelf particularly or something. Would it be smart for a town like this to make itself the repository of a few hundred copies of each to be able to respond initially to an emergency before supply is able to come in from some external source? Because there did seem in this pandemic to be a delayed response on the capability to do that.
I think it was a delayed response on behalf of the federal government not to use the national stockpile in which they had available to them to be dispersed to doctors, nursing homes, hospitals, public health, first responders. Since we did get those supplies, we all got our supplies from our different, our designated areas. Like hospitals got their own PPE, first responders that got their own PPE. The health department got PPE for the doctors in the community. But since then, we do have some kind of level of supply.
You have some now.
We do have them now. We all have them now. The problem is that there's shelf life for everything. Gloves, masks, N95s, especially N95s. If you're going to wear that, you're going to have to wear that. Make sure that they are not expired, because if you have to wear an N95, that is an ultimate protection so that you don't get transmission of the disease. So if you're riding on a rig or you're a doctor and taking care of COVID-19 patients, you can't wear something that is expired. So they all have shelf lives. So to answer your questions, we all have some kind of supplies, not huge stockpiles of supplies, but we have it. Will it be available or will it not be expired when we hit the next, rough road, pandemic or any kind of an outbreak? No one knows.
So Caroline, I think one of the comments that came out of this was all the work that you and your staff did, and, the long days and no stop of coming into town hall, you, Debbie, and the rest of the department. And also, I want to at the same time thank the finance department, Pete and Roland, who were here in the building with you also. So there were some really, to keep it running and to keep, make sure that everyone had their appropriations, money on time, and everything else. I think, we all owed a lot to the town hall staff, and we thank you. So I think we've learned a lot from Caroline on this one, and do we have a motion to approve?
I would move that we approve this item and recommend it for approval to the full BET and call it a routine item to spare Caroline the need to come back on Monday night.
It's Andy Deuce. I would second that. I also have a comment.
Okay, so we have a motion by Jeff and seconded by Andy. All those in favor?
How about the comment, maybe?
Oh.
Andy said he had a comment.
I have a
Oh, I'm sorry. You
one
have a
comment. So the proposal, the motion is to make this a routine. I ideally would love to have the BET have the benefit of hearing your comments directly, and I know that'd be extra imposition on you, but I always learn when you make these appearances, and it's always been very instructive to hear your thoughts today. And if they're not fully aware, I think they are, but if they're not, it's always helpful to have them appreciate all the things that you have done over the period of the course of the pandemic. That being said, I will accept the motion's characterization of this as routine and not compel you to come back to the BET.
Okay, so those in favor?
Aye.
So it's 4-0-0, and Caroline, Debbie, thank you so much for coming, and it would appear that you don't have to come. But, you know, you never know, so keep your eye on that agenda. Thank you so much. Okay, so our next one that we have today is out of the First Selectman's office, and I don't see anyone. So this is a release of conditions. I think this is Nathaniel Witherall, and it's for $942.50. So do we have any information on this, Andy?
Well, perhaps
Andy Deuce.
I could add in Ben's absence. This is, you may recall, in the budget for this year, $25,000 were appropriated to the First Selectman's office to fund whatever needs might arise for the Nathaniel Witherall RFP Evaluation Committee, which has been meeting for the past year. It had a waiver in June for monies for a capital needs assessment that went into the data room that was being prepared at the time. The requested amount today of $942.50 is for some additional analysis that were believed necessary to supplement the other documents in the data room. And that was a study done by PKF O'Connor, by Tom Marion, who's a longtime advisor to the Nathaniel Witherall. So what's being sought today is a release of conditions to allow these monies to be, this invoice to be paid out of this appropriation to the First Selectman's office.
Mr. Raymer.
So when the matter came before us in June, of course, I voted against it at that time and made some remarks at that time. I don't want to talk at great length because we're talking about $942.50, and remarks easily get out of proportion with it. Respectfully, the appropriation was not made available for the assistance of the First Selectman in handling the RFP. It was funds that were made available to the First Selectman for consulting fees if he needed it in the process of a review of the operation at Nathaniel Witherall. It only came up later that did seem to be then become an RFP leading to a sale or lease or whatever of the facility or the operation, or perhaps hiring a manager. We don't really know which, because none of that has become public. I don't frankly support at this point anyway, taking that facility and selling it or leasing it or hiring a different operating manager. My own view of it is that the facility should be allowed an opportunity with its new management to have a year or two of operation free of COVID, and then take a look at where it is. So I had objected in June to $8,000 being used to further this sales process, which is how I had viewed it. So I'll vote against the $942, mostly out of principle, to be consistent with my vote in June, that I feel that this was not the appropriation for which, this is not the purpose for which the appropriation was made last spring.
Okay, Leslie?
Andy, can you give me a little bit more understanding of what we're looking at in this appropriation? So I agree with Jeff that I thought our intent of the $25,000 was to assist the town's evaluation of the proposals that we are getting. I don't quite understand the explanation here, but I believe this is for outside services used to develop our information for use by the bidders on the project, right? So it's sort of a different use. It is under $1,000. My guess is there's a reason no department is willing to pay $1,000 despite lots of budgets out there at either the first selectman's budget or even Nathaniel Witherell's budget to cover this expense. So can you give me a little bit more understanding of what this is?
Well, yes, both the expenditure for the capital needs assessment and this proposed expenditure is to help gain a better understanding of the operations of the facility. Larry Simon, the chair of the board of Nathaniel Witherell, is on record for saying the capital needs assessment that was done this past summer and funded by the $8,000 allocation this past June was a very helpful study, regardless of what work is being done or not done, undertaken by the evaluation committee. The work that's being requested to be funded today is for some Medicaid analyses for which one of their outside auditors helped prepare, which the facility has found to be very helpful into how they operate their business. It just happens to also be a helpful document for outside parties to consider in evaluating the facility. I think it's very much within the bounds of the parameters for the $25,000 allocation that was made for this year's budget in the first selectman's office. I should probably add the work of the RFP evaluation committee is ongoing. It cannot be disclosed by town rules publicly about any names of any other parties we're in discussions with. Prospectively, if and when the committee makes a recommendation, it'll be to the first selectman, and the path thereafter will be to go to the board of the Nathaniel Witherell for its consideration before it goes on to the RTM. Yes, Jeff?
When we approved the funds that were successfully released in June, the point that was made at the time was that the capital needs assessment is a standard document that's produced as part of a sales process to inform and entice the bidders. And the point that I made at the time was, well, then you're providing information that's intended to be useful for the bidders, not information that was intended to inform the first selectman and his people. They already knew the information, but the information needed to be gathered for the bidders. And that was the difference. You did point out in rebuttal at the time, and that was not unconvincing, that Larry Simon had mentioned that, well, along the way, he benefited greatly from having the information. And I thought that was a worthy point. But I was still induced by the basic principle that this was not a process of making ourselves better informed with some consulting help, that this was a sales document that was meant to make the bidders better informed, to entice them to bid on a sales process that I didn't yet support myself.
There is no sales document. As I mentioned, this is all part of an effort to fully have the right resources available in a data room. A data room that's looked at certain selected third parties, but also it's been of great effect, and Larry is on record for saying this, that this has been extremely helpful for him in managing the facility, having access to this information, which he had not seen before, and it'll be very helpful for him going forward. So it has dual purposes here, yes, and I recognize that. But Larry will continue to assert this has been extremely helpful for him and also for John and the rest of the management there at Nathaniel in understanding how to best operate the business.
I think we've talked more than $942.50 worth here.
I'm
ready to vote.
Can I just
Leslie
ask
has-
one more
Leslie has a comment?
question? If this is not approved by the BET, that it looks like this expenditure's already been encumbered, or not encumbered, it's been made. There's a bill here
We've
for time.
received an invoice. It's not been paid yet.
It's not been paid, but the work's been done.
Yes.
So how would this bill be paid if it's not approved out of this fund?
Well, given the size, I suppose the Nathaniel Witherall would have to pay the bill.
So I'll just make a further comment. I would think that in addition to Mr. Simon and the board learning from this, also the other people that are working with the committee, you and I believe Beth, I don't know if there are others, are also learning more in the process of information that should be a benefit to the town in terms of managing Witherall. So, is there a motion to release the conditions on $942.50?
Okay, this is Andy Deuce. I move that we release the conditions and allow the expenditure of this $942.
And this is a recommendation of the release of a condition.
Yes.
So, is there a second?
You'll have to second it.
I'm sorry?
You will have to second it.
So I'll second that motion. Okay, so I'll take a vote. Andy?
Yes.
Leslie?
No.
Jeff?
No.
And I, Leslie Tarkington, will vote yes. So this release of conditions will not come,
No, it goes to the full BET, but it goes to the full BET with a report from you of a 2-2 vote.
right. So I was going to say that we are not recommending it because our role on release of conditions is only a recommendation. We don't
Correct.
make decisions on
Correct, sorry.
routine or not routine.
Sorry.
So you agree with that?
I definitely agree with that.
Okay, great. So, thank you. Okay, so we'll move on now to TAG. And we welcome Mike Miller, our, I guess, acting chairman still of TAG? President, sorry, president of TAG. And so I don't think you need to spend too much time on this since I think we just saw you last month.
Correct.
So do you want to explain what has happened in the last month and what you're requesting? And again, we have a release of conditions for, we'll call it the third quarter of this fiscal year for $75,000.
Correct. Very simply, and this was mentioned at last month's meeting as we were closing up the TAG presentation. The forecast for this year included and currently includes, as well as the plan had originally included as well, some funds related to the ARP program, the American Recovery Program. The timing of those funds was unclear, and we now seem to have more clarity as to how the process works, and it looks like the expectation is recommendations are going to be made later on in this fiscal year with potential for distribution probably no earlier than the spring. So as a result of that, we are currently running at a lower level of operations that is continuing to improve from the depths of the COVID crisis. We're continuing to improve our program fees. We have a new program that was brought on board with Pathways, which will be a substantial number. Over the course of the year, we are improving the Y. It now has much more kids attending their program, and as a result, our expectation is that we'll probably overachieve the number that we have in our forecast as well. And we've had some significant headway on other program fees related to townwide events, such as the town party that took place in the fall, and we had a tremendous amount of camp business that we transported people throughout the community, kids throughout the community, and those fees come to us on a cash basis in our first quarter, July, August, September. So even though we're picking up in terms of our program revenues, we're still short. Our traditional time frame for our fundraising typically takes place later in our fiscal year, in the spring. We had hoped to have in our plan some fall fundraising, physical fundraiser. The plan was put together last winter, and when we presented it in February, it was before, I guess we just heard about the fifth resurgence of COVID in the community, so it was before the Delta had kicked in at its height, and so we had to scramble and reschedule that. Now it's rescheduled for what had traditionally been a springtime event. And so with the advent of our later in the year fundraising and our improving, although we're not yet at the height of our program fees that we expect to be later on in the year, and now an understanding that the ARP funds will probably not be distributed prior to the spring. We find ourselves in a cash flow situation where we would request that at a minimum 50% of our remaining funds of $151,000, we'll call it $75,000 to round, be accelerated from January, which was the original planned amount, and moved forward into the month of October. And that's what we're requesting.
Thank you. Jeff?
Yeah, my interest is in two areas. In your projections, you were originally budgeted for, and you're still budgeted for, the feed grantage support of $195,000. The other one I'm going to ask about is the fundraising at $129,500, which was also part of your original budget, and you're still holding to that figure. Let me ask about the second one first. Of the $129,500 of fundraising, how much have you actually received at this point for the current year?
So I would draw your attention to the cash flow forecast on a monthly basis.
All right.
And in the actual section, if you take a look at both pandemic support and fundraising, but fundraising in particular, we're about 5,000 of the way into our 129,000. And that's not an atypical amount. Early in the year, we typically don't have a tremendous amount of fundraising. Right. In our second quarter, which is fall leading into winter, that's when we do our first appeal of the year, and those appeal letters just recently went out to the community. And so we've already started to see some feedback from that, and we're expecting certainly, as you see the numbers from October to December, we're looking at between $25,000 and $30,000. 27 is the number that's there. But that is typical of the way that our fundraising has been on a year-to-year basis.
Thank you for that assistance. Looking at the same monthly schedule then on the feed grantage support, the reference of $65,000 received in, or budgeted to be received, forecast to be received in July. You've received those funds, the $65,000?
Yeah, that's part of the actual. And what had happened is our second application for CDBG funds was approved in, I want to say, late winter, early spring of 2021. We finally were able to sign a contract with HUD in June, and the funds were ultimately distributed in July.
And that's the $65,000.
That's the $65,000.
The 130 that you're showing for April, 130 out of the 195, then is that, am I understanding that correctly? Please feel free to correct me if I'm wrong. That's in the expectation that a similar $65,000 amount would be approved by CBDG going forward, and that the
No,
remaining of that
that
fund?
is,
No.
that is not what that
What is-
number
what
is.
is the
What that
hun-
number
what is
is
the
based
130?
upon. The number is based on what we would expect to request and make an application for as part of the ARP application process, once that application is made available. And so that is, as I said, we only can go as fast as the process goes, and at this point in time, there have been no applications or process that we've been requested to submit any documents to. But when we do, that would be our request based on these forecasts.
So that 130 is in the hope or expectation of receiving 130 in ARP funds
From the ARP program.
from the ARP program?
Yes.
Okay, gotcha, thank you.
So I'll ask a follow-on question to
Sure.
Jeff's. That the funding for the ARP, do you plan to apply directly? What program would you be asking for to access the ARP money?
So my understanding is, and I took a look at the committee, for lack of a better word, several members of whom are present. We would be working with the committee members. Obviously, we work directly with the First Selectman's office through Ben Brannion, and so once he has the information for us, and he's one of the members of the ARP committee, as is Leslie Moriarty and Leslie Tarkington. So I just wanted to make sure that we don't get ahead of ourselves, and at this point in time, we have not been given any information other than do not expect the process to take place prior to the spring.
So-
Or at least, don't expect any funding out of the process prior to the spring.
Right, I just want to make sure that you're talking with Ben about that and making sure you're on someone's list. So
Oh,
I
absolutely.
encourage that.
Absolutely.
Any more questions? Leslie?
So I just want to point out, I did receive the TAG fundraising letter recently and learned that you assisted our residents during the cleanup from Hurricane Ida, which is an additional service you've provided that I guess I was not aware of.
Thank you for bringing that up. One of the tremendous benefits of having the relationship with TAG that the community has is when there are times where the town is met with a crisis, and there have been a variety of them, but the most notable ones are typically surrounding storms that hit the community. And it is quite typical that when a storm hits, that TAG is called upon to help either first responders alongside, or in fact, a specific role of transporting individuals to shelters within the community and other services as a transportation organization can provide. Specifically with Storm Ida, what had, and this, I believe this was following, this is the additional storm that came through that was supposedly a remnant storm, but caused a lot of damage and some flooding. And what happened particularly in this instance was one of our senior facilities on North King Street, Regal Care, in the middle of the night was totally flooded. And that houses dozens of residents who are struggling with a variety of age-related illnesses, including dementia and Alzheimer's. These residents were woken by staff in the middle of the night to find that there was water throughout the facility. So in the middle of the night, they would normally be disoriented, but their home for a period of time was now uninhabitable. Chief Heavey had called to TAG and asked if TAG could help in the evacuation of this facility. And what happened was our executive director, several members of our family, several drivers mobilized Buses were picked up at TAG, which is on the other end of town, which was difficult in and of itself because many roads were unpassable. Then traveling through a variety of highways and few passable roads there were, this group made their way to Regal Care and worked throughout the night until dawn alongside first responders. GEMS was there as well, as well as police and fire. And by dawn, all of the residents and staff of Regal Care had been relocated to another senior center facility within the community, not too far away, as a matter of fact, Greenwich Woods. But that is something that TAG provides to this community and has always provided to this community, particularly during difficult times, whether it's Superstorm Sandy or any of a number of others, Irene as well. So thank you very much for bringing that up. Happy to talk about it.
Leslie, you have more?
Yeah, no, I
questions?
just want to, look, this is stating the obvious, and it's not going to be news to Mr. Miller. You know, TAG, which started a transition 4 years ago now, whenever it was, because of the change in the state contract, has been working very hard to find a balance and a structure that works to make it cost neutral using an assistance from the town. COVID created additional challenges, and I think you're still struggling with the revenue model to support the expenses. It relies on the existing grant from the town. It's relying now on an additional support from ARP. But you're also providing a valuable service in Dial-A-Ride, which isn't clear how those services would be provided to the residents that really rely on that service otherwise. And you provide a benefit during other times of need, as you just explained. The businesses that you take on and the other services you're providing is intended to help offset the costs for providing those services, which we provide for less than what they actually would cost to maintain. So you're continuing to work really hard to continue this model. I support that. There's challenges seem to creep up every time you come in. Your request right now is for half of the remaining support. I would like to suggest that this board consider, and I'll make the motion at the appropriate time. We release the full amount at the moment. It's 2 months earlier than for the other 75,000. We could ask for a written report if we want, but I am not sure what additional information we will learn in 2 months' time about the TAG situation, when we know in February we should actually spend more time and talk about what the plan is for TAG, because it's the structure, I'm not sure it's giving the right incentives as we're currently looking at this. By making them come sort of hand to mouth so frequently, it doesn't allow them to create a longer term plan. So I know I'm interested every month when we see your cash flow, how it goes against the plan. I think it's interesting information. I'm not sure it changes our decision about releasing the funds in 2 months.
So I have a follow-on question, following from Leslie's question for you, Mike. I see that, obviously you have plugged in the $75,000 for October, but then next month in November, you have a further shortfall of $43,000, and the following month, December, $6,000. So that's $49,000. So while if we release the conditions on the 75, you'll have a positive cash at the end of the month. It looks like November is a problem, and is December not quite so much a problem? Or you just, in order not to be a problem, you have to do a lot more of something, fundraising or something, right?
Well, there'll be a surplus after this month.
After this month, there's a surplus, but next month it goes negative again, 43,000. So I'm trying to find out support for your
Okay.
comment. So I'm trying to understand.
So
That's
what
not
I
accumulative.
would suggest and bring your attention to is that by the first 6 months of the year, The expectation is with that 75,000 that we would be cash neutral for those first 6 months of the year.
Okay.
And so irrespective of the timing of when the cash comes in, which is going to drive a certain month being much higher than break even, another month being lower if the cash, and by cash I'm talking about town support. So had the town support come in ratably throughout the first quarter, there'd be fewer ups and down swings. But for the first half of the year, the first 6 months, the expectation is a cash neutral with that 75,000.
The figures at the bottom.
Excuse me, Jeff, you weren't called on. Thank you. Andy, do you have any comments?
Well, just to expand on that, cash neutral, yes, but you will have received 3/4 of the annual town contribution for the first 6 months.
And we will have received 0 of the 130,000 of ARP funds.
Yeah, it's, and the timing of which is still uncertain, even though for those who are serving on the committee. So I don't know. There's lots of uncertainty here, and sort of going to the lines that my colleague Leslie had mentioned. But her point, I thought, was an interesting one, in that we're not going to learn that much, though, over the next 3 months, are we? Again, the thought was possibly to combine the balance, the total balance, and make a payment earlier than waiting until paying out the balance in January.
Our expectation is at present that there's not going to be another major wave such as what happened when the Delta variant wave came through, and we just heard that announced by the health director, that there's not an expectation even during the winter that when transmissions do ramp up, there's not an expectation that the type of issues that were experienced earlier in the pandemic will be experienced again. What that allows for with what we are doing at TAG is it will mean that the continued upswing of organizations that had closed down or were operating at reduced capacity, we should continue to see that upswing, and therefore the numbers that we're looking at here should be achieved. Obviously, if there's another variant that comes through that packs a wallop that is unforeseen, we'll respond to that when it happens. But right now, we can't plan for that. We can only take the best information available, and we just heard with the best information that's available from our health department that there's no expectation that another Delta-type variant is waiting in the wings imminently.
Thank you. Jeff, did you have something?
Yeah, I did. I mean, I think that very interesting things that we've heard today. I think the episode with Regal, is that the name of the Regal facility?
Regal
was,
Care.
was a perfect example of the degree to which the town is committed to having there be a tag in town that responds. It doesn't matter whether you're distributing food for neighbor to neighbor at a moment when food insecurity in town was exploding, or whether we're distributing food to school children, localities at which they're picking it up, or moving patients from one nursing home to another at a moment of flooding. Without any anticipation, we look to TAG to step in and rescue us. And so, I mean, it makes it perfectly plain to me that we need to keep TAG viable, at least unless we see some other alternative. I think the town needs TAG, and I think we need to do what you need to do. I wouldn't actually support the motion of Mrs. Moriarty at the point that she makes it to release the whole amount. I think I'd rather stay in tune with TAG, bring Mike, bring Mr. Miller back to us again. And I'm sorry to keep doing this to you. You devote a lot of uncompensated time as a volunteer to support this facility. But clearly, this is a facility that is still having a tough time financially. and is reliant upon hopes and expectations for tomorrow at various points. I think the town should be staying in close, I think a finance board should be staying in close contact with TAG. And so I will gladly release the $75,000 that you're looking for, but I would prefer not to be releasing the $151,000. That would be my vote at the appropriate time, assuming that motion is going to be made.
So are you making a motion to,
Well, I would make a motion to approve the request that's before us, $75,000. And I think I'd be inclined, I'd be interested in what my colleagues think about whether or not this should be routine or non-routine. I'm wondering, to pick up on something that Mr. Doucet said earlier, maybe the full BET should be kept apprised of what's going on, and maybe a visit from Mr. Miller to the full BET would be a useful thing. But I'll be interested in the remarks of my colleagues on that.
so,
My motion for the moment is to approve the item and recommend its approval to the BET.
without routine or non-routine? I guess I'd prefer it to be routine, and then we'll let the chairman decide whether it be routine or not routine, from that standpoint. I do have is there a second to your motion? I'm sorry.
I will second that.
Andy
Andy
Deuce
Deuce will second the motion.
Andy Deuce is seconding the motion. Sorry about that, I shouldn't have spoken until. I do have a question, though. Are you also applying for community development block grant?
The bulk of the community development block grants are for capital expenditures. And so where our need is mostly operational. And so there would be a very small amount of that might be available to TAG, maybe up to $5,000 to $10,000 might be available. So we could, but at this point in time, we don't have that on our calendar.
I would encourage you, I know the last year you didn't apply to the community development block grant for that second wave there. I would encourage you to apply and continue to look for multiple resources, because it also keeps your name out there. It keeps your name so that people will recognize that, you need fundraising, you need contributions in order to keep it going, as Mr. Raymer suggested. So, in this comments here, I just want to suggest you to encourage you to apply for that program also, because it keeps your name out there. Maybe the program will change, whatever, maybe you get a little bit more, I don't know. Because I'm not involved in the program, but.
And that's much appreciated. And last year, we applied twice for two of the programs that were affiliated with funds that came into the community from the federal government as part of the COVID crisis. And we were successful in a large fashion, one of the largest, if not the largest, beneficiaries of those funds for each of those programs. So the third program that came in, which was more normal and ordinary, if you will, typical process, that was the program where we spoke with the chair, who made it perfectly clear that there was about $500,000 of operational application funds that were chasing less than $100,000 of the total $800,000 available of total funds. And so a 5-to-1 expectation, we were told that any one organization would probably not be expected to achieve more than $5,000 to $10,000. At that point in time, I had suggested to the CDBG chair that it would probably make the most sense, because there are many other organizations who did not have the opportunity that TAG had earlier with those other two fundings. Those organizations would benefit by not having TAG's 100,000 application in there, so there would only be a 400,000 to 100,000 view of applications to available funds.
Well,
And so that's
again,
why I was called
I-
back that time, but I totally appreciate your thought here, and we will go back and look at the current application process and see if that's something that we can participate
So I would
in.
encourage you to do that for every single opportunity for, community development block grant, anything. I think that the town departments need to work with TAG as well as the BET. So I encourage you also, this is my own opinion, to, as the departments put together their budgets, which need to be in by some date like December 1, to make sure you've got good contact with the senior center, River House, Witherall, as they're putting together the budgets, to see if there's any opportunity for you to, ramp up your programs again with them. So with that, I think I will take a vote. So, Jeff?
So the motion that's before us is a motion to approve the release of the 75,000. I vote yay.
And that motion was moved by you and seconded by Andy. Andy?
Yes.
Leslie?
Just to qualify, I did not make my motion to amend only because I knew it was going to fail. But I will support the release of 75,000.
I'm sorry, Leslie, you didn't,
I was going
you
to
were
make.
talking to about it, you didn't.
I talked about making
Right.
a motion to amend to
Right.
release the entire 151, but hearing the discussion, I knew it would not pass, so I didn't want to
Okay.
waste our time, although
Okay,
I did
so-
just explain that. So I vote to approve.
So Leslie Tarkington also votes to approve, so that's 4-0-0. And this is a recommendation for release of condition. So, as you know, these are only recommendations, so you will have to come back to the full BET because that's the process, right? We don't do release of conditions as routine or non-routine. We only do it as recommendations. We just recommended a release of conditions by 4 people.
I see. I'd have to go back to our reference manual, but.
So anyway, thank you very much, and we always appreciate your updates, and we will be seeing you before too long.
And thank you for the support throughout.
Thank you for all the
several
time you put into this organization, heart and soul.
So now, in all of these papers, I've lost my agenda, folks. You have all your agenda.
Yes, it's the economic conditions is where we are.
So, thank you. Roland, that ends our request for budget adjustments. And now we're going to talk about economic conditions report, Roland, and get the good news for the month of September.
The three items continue to well conveyance and building permits. Building permits is over 600,000, which we haven't gotten in a while. Conveyance is down a little bit. It's not at the $1 million plus level anymore, but still quite good. The other areas of increased revenue are we received almost $4 million in bridge revenue through September, which we did not receive any at that point through September a year ago.
So that's great news.
And we got almost $50 million more in tax collections because there was no,
Moratorium, yeah.
whatever the term was,
Yeah, right.
deferral.
Right.
So we collected that ahead of a year ago. So those items add up to $20 million more collections this year through September than a year ago.
Wow, that's great.
That, of course, will level out once you get past that. But the additional bridge revenue is interesting.
The bridge revenue, that's great. Do we know which bridges?
I don't know offhand.
I don't mean to put you on the spot.
It's on the detail of the revenue, Sound Beach Avenue Bridge and Frontage Road, Delvin Avenue Improvement. Those total $4 million. And those are all reimbursements, correct?
Yes.
Madam Chair,
Andy?
Roland? I see in your more detailed schedules only an incremental 12 million from taxes. You just said it was an incremental 20 million?
No, taxes is, the total revenue is 20 million ahead of last year. The taxes are only 14 and a half.
He's missing.
Okay, got it. I see.
You have to add the motor
business.
vehicle and the business.
Thank you.
Any other questions on the economic report?
In the case of the expenditures, we're 7.8 million, spending more this year than last year. 2.6 is higher OPEB and pension expenses. 2 million is a higher capital project paid with taxes. The Board of Ed is 1.9 million ahead of last year. Some of that is higher salaries, but 800,000 is higher spending on IT. This is the projects that were moved from capital into their operating. We have some of that impact as well in Parks and Recreation, where we moved organic turf from capital into operating.
Those are good points, Roland.
If I can ask a question, just on Nathaniel Witherell, because it's going to come up in our discussion over the guidelines. Through 3 months, if I look at the revenue for Nathaniel Witherell, I get $5 million of revenue, and expenses on this sheet show it at 6.6.
We didn't get September revenues from Nathaniel Witherell yet at this time. So there should be another 2 million plus.
Okay.
So if they have that updated, I can send that out over the next day or two.
Okay, thank you.
Roland, on the employee benefits, $3.4 million increase this past 3 months and the prior 3 months for the comparable period the prior year. That's almost 8% increase. That's almost an 8% increase. Could you add some color on that?
The benefits are the higher pension and OPEB costs.
Oh, okay. Thank you.
So just coming back to the revenues really quickly, the September conveyance taxes were down by about a third from the previous month, from August. I guess we had heard that there was a large one in there in August. Do we know? It seems softer than, say, last year in September. But I noticed that building permits are, very strong in September.
I don't know if there's any large ones in there.
Okay, so thank you, Roland. I guess we have no more questions, and we are ready to move on to our next item, which is budget guidelines for fiscal year '23. And so we want to thank Roland and Pete very, very much for all their work in terms of answering our many, many questions and for their very fine input in terms of doing this. And also thank Andy and Leslie and Jeff for the work that they have put into this to date. So, Roland, I'm going to ask you to please run through the budget estimate, and we have large format copies for budget committee members, and I think Roland had some extras here too, if anyone wants a large format, because they find that print is hard to read on the smaller one. So Roland, can you just, run through, down the list of, just highlights? And then I'd ask that maybe we wait for Roland to do a run-through of all of that, and then maybe I'll just make a couple comments on the text and the other exhibits, and then open it up for wherever we go for there.
Sure.
Does that sound like a plan? Everyone agreeable to that? So Roland, would you like to run through the, Roland, somehow, if you could just pull that over, yeah, that works fine. But when you look that way and the thing is way over there and the mask is on, it's kind of hard.
We made a number of assumptions on salaries and on all of the other expenses. For the Board of Education, we used 2.93% for the certified staff, which is the cost of contract for the GEA employees. We used 2.25% for the other salaries, which seems to be close to what the average is. We have fire coming in at 2.3. Some contracts are 1.75, so we think that the 2.25 at this point is a reasonable amount. And we use 2.25% for the 2s, 3s, and 400s. In terms of the benefits, we assumed a 6% increase for healthcare. We increased the contributions from the employees. The pension contribution is based upon the most recent estimate that was provided in July by the actuary. And some of the other items were just sort of risk fund, withdrawal, school lunch. Those are just items that I guess were discussed, and this is where we are at this point. Other fixed charges was increased by 2.5%, and then reduced by $400,000 because we believe that the insurance costs will come down that much. Capital tax levy is a $1 million increase from 51 to 52 million. The use of fund balance was up slightly, and it comes down to a bill rate increase of 2.5% at this point.
So, thank you, Roland. The only other thing I'd add here is, when we talked about other revenues, we increased those likewise at the same 2.25% as we did the expenses. And, I think Pete gave us some additional information more recently than that some of the reimbursements or grants from the state would increase, I think it was a pilot, by another $500,000. So we had that. So that's an overview of the estimate budget itself. In terms of the text itself, I would also like to say, we also credit Ken Borsak and the Greenwich Times for making sure that we're accurately reflecting percentages, which we took care of that immediately. So thank you, Mr. Borsak. Anyway, let's get to the text. It's a bit more brief this year than we've had in recent years. Not too brief, but briefer. And I think what's very important to make a statement here is that we're really very proud of the accomplishments achieved by the town and the BOE schools and Town of Greenwich staff during this whole lingering COVID-19 pandemic. And we really thank everyone for their extraordinary efforts. And that includes the volunteers, the appointing authorities. It's really, everyone has done an amazing, commendable job. We've learned lessons from this period, and we expect some of those lessons learned to be implemented in 23. And of course, we always want to look for new opportunities for efficiencies and cost savings. So, I think in terms of the estimate budget, we'll probably hear some comments on those. So I don't think I need to run through them individually. This is an estimate that does not reflect any benefit as such from the revaluation. So we're doing it basically as if there were not a revaluation year, and used an increase of revenues of about 0.75 of a point, 0.74. On average, over the last 5 years, the average increase has been 1.0%. So this is still conservative compared to that, and again, doesn't reflect the revaluation itself. We also included, a couple sections on the ESSER and the ARP grant money that will be coming in, because we know that this will have an impact positively in terms of the town and the benefits to the town and its residents. But we also know that it will be like running two separate processes. And we also have to understand that we still sort of have the same groups of people working on these multiple programs. And, we're continuing to look and want identifications of recommendations for these expenditures, and then we will all have to work together to execute that program in parallel with this budget. You know, I think we always can go through the details of this, but I don't think that's necessary unless anyone wants to bring up anything. We hope for capital prioritization of projects. I think that's going to be important. And, you know, it's good to know that we got bridge money in. We're always looking, and I think we'll spend more time on timely reimbursements, you know, and tracking those. I think that will be helpful to all. So anyway, we understand overall the impact of property taxes on all our residents. We understand, we heard earlier, you know, report from Human Services in our ARP meeting. You know, we have 29, 30% Alice families in the town of Greenwich. We heard about other hardships. So we're trying to use this budget and the hearings that will occur in February to find this balance between the town and the BOE schools and their costs, and still making it affordable for all. So in order to do this and to go through our February meetings, you know, we want to thank, again, the first selectman, you know, the superintendent of schools, the Board of Education, because there's a lot of upcoming work that they'll be working on for their operating and capital budgets and for their presentations that they will make during our February department meetings. So one of the things, so that sort of is the text, a summary, quick summary of the text, and I'm going to just take a couple minutes on the exhibits. So once again, this year, as in last year, we have very similar exhibits, and we want to thank Roland for this. And this also helps us to allocate both the, well, when we did the salary adjustments in understanding the various payroll groups, and also the allocation of benefits between the town and the BOE. So Roland has put together, you know, an Exhibit 2, which shows the breakdown of those benefits that you see allocated on the, in the estimate. So we have that. And then we also have an Exhibit 3, and that sort of shows, again, every department and shows the benefits as a percent of the budget. And I think this is important because it's not only the salary costs of the employees, but also their benefit costs. And this gives a perspective by department. And then finally, well, not quite finally, but Exhibit 4, once again, focuses on our employees and their benefit costs. And this time, the focus is on by their
Union.
bargaining
Okay.
group, representative group, and, but they're not all union, Jeff. Some of them are
Right.
MC and et cetera. So we see the different groups and all of their benefit costs, so breaking it down. And finally, we have a proposed meeting schedule, budget meeting calendar. And at the moment, we're expecting the kickoff of the budget to be on January 25th. And, you know, the process, at least through the budget committee, to end somewhere, well, it would be nice if we only had one decision day, but certainly by March 3rd. So that is the overall plan, looking ahead. And with that, I will ask if there is I think what I you know, and I take your advice here, a motion to approve the budget guidelines, and then we can go through and any discussions, or
Yeah.
if there are any amendments thereafter?
Yeah, just procedurally, I think that'd be appropriate, that there should be a motion to approve in a second, and then discussion and any motions to amend, I think would be the logical way to proceed.
So, Jeff, are you willing to do
Yeah,
a motion to approve?
I will have some motions to amend in a moment, but I would gladly make a motion to approve the guidelines being proposed.
Is there a second?
Andy Duce seconds that.
If I can, though.
Okay, so any discussion? Leslie, you want to start discussion, or would you like to defer to Jeff, or how would you like to do it?
Let me just start with some general comments, and then if Jeff can take over from there.
Well, I might go back to Ann, just so keep it balanced, if that's all right with you.
Okay, but I'll refer to some, okay.
Okay, however, we'll work it out.
Look, the guidelines, I think in recent years, the guidelines have been used not as guidelines, but as a cap, and that trend has concerned me as we went through the past few budget cycles. There has been an attempt in this guidelines, and hopefully it'll be successful, that the text reinforces the guidelines to be what they are, which is that they are guidelines. They're using information that we have available at this time to then lay out what a financial scenario might look at for the budget going forward. And the kinds of things that we don't know at this time is we don't know new initiatives. We don't know what the real impact on programs that might alter the way we deliver services that could reduce costs or increase costs. We know that this board has already approved some new positions, and we don't know how that lays out in the total town's table of organization. And those are all things that we find out about in February, during discussions, during allowing the departments to take the time to develop their proposals, to develop what their initiatives are and their plans, as opposed to what they've been funded so far in previous years. We also look at a budget-to-budget comparison, not a budget-to-actual comparison, and that's something this board has always acknowledged. We don't have better information at the time we're approving our budgets, but that's something that we look at. So I'm glad to see that the text in the guidelines, which has changed from September to October, as we've kind of gone back and forth a little bit with suggestions, has really focused on the fact that these are intended to be guidelines. The other thing that happens when we put in Exhibit 1 is it identifies the levers that the BET has at its disposal to adjust mill rates, right? So one, we have the lever to change operating budgets and capital budgets for departments and towns, but then we also have the use of our fund balance. And the things that we take into account when we're looking at that is both our experience with what the fund balance is, our comparison to our policies of what our funds are. We don't want to tax our residents more than we need to. And if our fund balances are healthy, we should be using more of that. In this particular, but staying on that point, the more we use fund balance, the more at risk or potential variability there is in future years of tax impacts on taxes, because we don't have that built into the flow of the mill rate or the taxes coming into date. So there are a lot of variables here. As we play with the use of fund balances and the other sources in our guidelines, it sort of blurs the focus away from what this is intended to do, which is to tell the operating departments and the Board of Ed and the other appointing authorities what it is we're asking or what we know now, and tell us what we should know differently. And it kind of focuses on the way we would finance it. And I think that that's gotten a little bit out of whack, if you will, again, as we focus on this Exhibit 1 only, to the exclusion of the language we have in our document. So as Mr. Raymer indicated on all of these, and I'm sure Mr. Deuce has comments too, the numbers here try to reflect best guess, but there also are assumptions. I don't think we're in the same place on all of these numbers. When we vote to authorize or approve guidelines, it's often a compromise document. There's some things we agree with individually, and other things, if I were doing it all by myself, I would come up with different numbers here. Don't know whether how much that might change it at the bottom. The one area, which is a particular note, and I think we should discuss a little bit, just to make sure it's well understood, is the way we're funding capital, and that we're using a significant amount of money out of the capital non-recurring account to fund the capital program, which in theory, our capital non-recurring account we identified last year has gotten to a point where probably we can reduce that number. It's a use of sources, but by not having the capital tax levy itself, which we don't really identify with a line caption on the chart, since it's not built into a tax base going forward, it is a risk that we have that as our capital needs might increase over the amount of funding that this capital tax levy can fund going forward, we're going to have variations in that mill rate potentially and calls on need. So just as I've probably gotten too much into the weeds, half the audience probably doesn't understand a lot of these factors, but again, I think that some of the numbers on this page definitely represent a compromise among the four of us, and we'll find out where those things are. But the language in the text, I think, has been improved to really focus on the fact that they're guidelines. So, thanks.
Thank you. So, I don't know, Andy or Jeff?
You said you wanted to speak to Andy first.
Andy?
Thank you, Leslie. And Leslie Moriarty, thank you for your comments. Those are all always helpful. I will point out, in terms of the use of a fund balance, as you know, a year ago we went to a different means of calculating it. We now use a budgetary fund balance that's identified in the annual financial report as a single number, a little bit easier to access and use. The number this past fiscal year end at June 30th was $68.3 million, which was about $9 million higher than the comparable number a year previously. So even though our number is a little bit higher for use of capital fund balance in this schedule than a year ago, as a percentage of available funds, it's a little bit less. I don't think it's imprudent. I actually, if I can, I had a question earlier, if I can perhaps go back in the weeds here with Mr. Geiger on Exhibit 2. Why do the pension numbers for the DB plan not correspond with what we see in the bigger exhibit?
Exhibit 2 is the allocation of the general fund. Exhibit 2 is the allocation of benefits for the general fund. It excludes all the other funds which the fixed charges in the budget include.
Okay. You can always count on me, Roland, for layup questions. Thank you. As Leslie Moriarty said, the text involves lots of considerations, lots of compromises. I think it's a very good document. I was personally very pleased to see it shrink in size from what we've had in prior years. And I think it could be a helpful document. I agree with Leslie Moriarty. I'm very happy to see it not necessarily be a no more than 2 document as opposed to one, here's some guidelines, and you go, let's as we get more information, we can figure it out and respond appropriately in the February meetings. Thank you.
Jeff, I'm sorry, I didn't have my microphone on.
No, that's right. So first of all, a nod to the chair. I had a certain measure of disappointment and dismay when I saw the initial draft that the chair had prepared and disseminated to the press with figures that I didn't think I'd be able to live with, and I was disappointed at the prospect that we were going to come to a point where there was a 2-2 vote here, failing to approve guidelines. So I want to point out, before I make certain motions that sounds like I'm being critical of the figures that are in it, that it was plain to me that the chair spent a lot of time and effort preparing this document. And the more work I did on the document, the more obvious it was to me how much time Mrs. Tarkington had spent preparing this. And I want to thank her for that effort. I also want to point out that a number of the figures have been adjusted. These are compromises that are whereby the members of this board are reaching out to other members of the board to reach compromises, and I'm grateful for that because I think we've come much, much closer. I will be making certain motions and the like, and those motions again sound like I'm criticizing the figures, but I think the bottom line here is that both sides have done a lot to reach out to each other, and that's laudable. That's the way a board ought to be working with itself, and doesn't always manage to do so.
Thank you,
but I
Jeff.
think it was a good start. That said, I do want to make a few comments if I can. First, Mr. Geiger's remarks about the basis for the salary figures were a little brief, and I know that there has not been a workshop, and there may be a listening audience, maybe there isn't, but there may be a listening audience that wanted to be a little more detailed. That yes, as Mr. Geiger had mentioned, the figure for the salary increases on the school side at 2.94 is based upon the GEA contract for 2023. Now, I was going to be a little more detailed to say, because you spoke just generally, you said the other unions were about 2.25. I was going to mention that our most populous unit, the Teamsters at 391 members, their salaries in 2023 are going up by exactly 2.25. Our second most populous unit, GMEA, is going up by 2.15. The third, LIUNA, we don't actually have a settled figure for 2023, I don't believe at this point. Fire, as was mentioned, are going up by 2.3. Police, we don't know. It's not being settled. I don't know whether or not fire forms a yardstick for police or not, and I don't think that's the third rail that I want to touch at this precise moment. But the reflection of our budget director, I thought, was quite right, that 2.25 does seem to be kind of a fair weighted average of what seems to be the union figures. And these were not just numbers picked out of the air, these were numbers that were entered into in this thoughtful, considered way, and I'm grateful for that, to both Mr. Geiger and also to Mrs. Tarkington. On the 2.25 inflation factor that's being attached to the 200s through the 800s, that's precisely the figure that Chairman Powell was citing in his release from the Fed on September 22nd, and I think that's a logical figure as well. I did have a question. I was surprised, and I don't know the basis for it. Roland, do you want to speak to the fact that you're not using 2.25 or any other figure for utilities? You're using 2% for the utilities. Did you have a chance to look back at the utility agreements? What's the basis for that?
We looked at the actual usage going back a number of years, and we're consistently below that number that we're budgeting.
So you felt comfortable with the 2% as being reflective based upon our actual experience?
Based upon what we know, we don't know what the contracts are going to be. We have contracts for some of them for the first 6 months of the year, but we don't know what it'll be after that.
Okay. Carrying on, sorry.
We actually looked at the percentages increases that were, from really 7 to 19% underneath this number. So we looked at actuals. We also did have a meeting with our purchasing director to, talk about timing of the contracts and so forth to get more details.
Well, so there
And,
again,
and so she's certainly going to be, she knows now what detail the budget committee will want in February and is prepared to put together those kind of schedules with the details.
good, thank you. Well, there's an example of the effort that I was talking about having been made. I was complimenting. I did have a concern going down just in sequence in which the items appear on Exhibit 1. The first point at which I found myself in an area of disagreement was in the risk fund. I have no way of knowing what cases will settle, what cases won't, how many people will sue us and what they'll sue us for and how these cases will be disposed of. But I did note that generally speaking, we receive an auditor's letter which places a value on what they think is the value on the pending cases. The town attorney wrote us a letter saying that we presently have 42 cases pending against the town, not a small number. Normally, these cases over the years past, I heard the controller mention at a recent meeting, are valuing these cases at about $3 million in settlement or disposition value, although in the past year, the controller said that we valued it at only 2.6 because of the courts being closed during the COVID epidemic. But I think that the $3 million figure was, to my mind, a bit more logical figure. We have more than 9 months left in fiscal year 22, plus the 12 months in fiscal year 23, and the risk fund stands right now at just a tad under $4.5 million, as I understood. I hope that figure is correct. We normally try not to be taking the risk fund and exhausting it to zero. We inherit from the prior years a small running balance and have some sort of an obligation to pass the risk fund on to the subsequent years with the same small running balance. And just intuitively, from my standpoint, especially now that we have a $3 million self-insured retainage on new cases that are being brought under the existing insurance policies, that somehow the $4.5 million sounded like a number that might about cover what was left, but would be exhausted to pretty well near zero and maybe wouldn't even reach, wouldn't even be quite enough to cover. Yes, we have substantial fund balance, but one has an obligation to be budgeting for what we think the expenses are really going to be. If you're planning to pay a part of your risk fund out of fund balance, you're basically saying, let's not pick up in mill rate to our taxpayers the operating costs that we really expect to be. Let's try and consume it, a part of it out of fund balance, and that's not right budgeting. To my mind, I would have taken the zero, which is being proposed for the upcoming year, and I would have proposed that we budget $1.5 million contribution to risk fund, with the expectation that over the 9 months for this current fiscal year and the 12 months to follow, we'll about exhaust the $4.5 million and be leaving about $1.5 million for the year that follows. And in a few moments, I'll make that motion. That'll be my first of 3 motions that I wanted to make. Item number 2 for me.
Do you want to just do it one at a time, and that way we can keep track of what you're talking about and we can respond?
Sure, at your pleasure. Then I would make the motion at this point, a motion to amend the motion that's before us, to take the line item that was shown for risk fund, presently at 0, and to budget instead $1.5 million.
I'll second that motion.
Okay. So you want any other
I've already
comments?
discussed it fully. Others should have a chance to
Andy,
speak
do you have
to
any
it.
comments on that, or Leslie?
Yes. Well, as Jeff alluded to, we've been advised by the town attorney, we do not need to make any additional contributions this year. But I think Jeff's broader point was that we probably want to allocate some sort of normalized amount to cover ups and downs, and an average amount, so we don't have budget variability from year to year. Of course, you can make that same argument about every line item in this budget, and they all, in aggregate, they tend to usually cancel each other out. So the radical changes from year to year really aren't seen. I'm very happy with the, having had the comments from the town attorney, I'm very happy to keep the allocation this year at 0.
You have anything, sir?
No, I'm gonna,
I was going to make a comment, but whenever you want to do it.
yes, thank you. I'm gonna support this motion. I think that we'll have better information come February on what we need here, what will be remaining. I'm not comfortable having it go down to 0. And so I think the nuances of the town attorney's comments on whether we'll fully utilize what we currently have in the risk fund or not are not well understood now.
So I won't be supporting this motion because, I think I've shared the town's risk manager did put together a memo at the request of Mr. Minorski. The town attorney has reviewed that. She has been busy preparing the updated letter to the auditors that I think you're referring to last year's letter, Jeff?
Yes.
And so, we have that. We also have the fact that the courts have been basically closed for the last year and a half. And the other side of it is we had COVID, so we weren't operating, well, we were operating, as we talked about, everyone was here, or certain people were here, but we didn't really have filings of cases and so forth, so that period now, those cases won't be coming through. The courts, while they've opened, it's my understanding that actually they're operating more slowly. They too have a problem getting clerks and so forth, the way everyone else is having a hard time hiring people. The town attorney felt that this is more than adequate, with a substantial balance left after, at the end of this, whatever, be a year and a half from now, and was not prepared to increase it and felt very comfortable. I think we're very fortunate to have the current town attorney and to take that person's advice. I too will be looking at it and reading that letter, and then of course the budget committee will get an update in February to see what is the status and so forth. But even the cases that, a month ago, we thought might be go to trial at X point, there are already scheduled further delays. So I'm very comfortable at this level. So should we take a
Vote.
vote on this? So, Mr. Raymer,
I'm voting yay.
Mr. Deuce,
No.
Ms. Moriarty,
Yes.
and Ms. Tarkington, no, so that motion fails. 2-0.
220. Carrying on then, if I may. The next item, going down the list on Exhibit 1 to the guidelines, is the subsidy to Nathaniel Witherell, presently shown in the draft that's before us at $1,125,000. I want to say, first of all, is one of the points where I thought there was a lot of accommodation, and I'm grateful for it. It was proposed originally, as the press may note, at only $750,000. It was then later proposed at $1 million, and then most recently, presently now, at $1,125,000. I do think, however, without my sounding ungrateful for the accommodations that have been extended, and I am grateful for the accommodations that have been proposed, the compromises that have been proposed, I want to just reflect back that it's important that this is an operating unit. If the operating unit is running at a negative, fair treatment of the taxpayers is to have there be a fairly fair reflection of your profits or losses in the mill rate, not just to assign it to negative fund balance and pick up some whopping sum later on, such as the $3.7 million that we're proposing to pay in this year from negative fund balance built up in the past. I think that's not the right way to budget. So looking back at the recent history to get a sense, let's look at fiscal year 20. The actual figures, more or less round numbers if you don't mind, but the actual figures are that in fiscal year 20, the facility lost more or less $5.2 million. And we were budgeting for a subsidy of $3 million, which means that there was $2.2 million that was assigned into negative fund balance over and above the subsidy. But the subsidy for fiscal year 20 was $3 million. Fiscal year 20 was, the majority of it was pre-COVID, but the last quarter of it was certainly post-COVID. And COVID is a factor, and it was a not unimportant factor. And so it makes you have a slight doubt about whether those figures are reflective of what we'll experience in 23, but it's, these are the figures that I have. In fiscal year 21, that was a year which was heavily affected by COVID. I don't know. And so we had lots of census drop, but we also had lots of replacement subsidy coming in from the state. And all of those are artificial numbers that are perhaps not very reflective of what to expect in 23. But anyway, let's look at those numbers. In that case, we had reduced the subsidy from $3 million down to $1.5 million. And we suffered a loss even after the reimbursements from the state and federal government and things for COVID. We suffered a loss of about another $1.6 million, or an overall loss of about $3 million. And again, I don't know exactly how reflective it is. For fiscal year, and that was fiscal year 21. For the current year, we're budgeting a subsidy, that means fiscal year 22, the year we're in right now. We're budgeting for a subsidy of $1.5 million, but we're budgeting to have a loss beyond that of another $1.8 million, or overall a total loss of about $3.3 million. And the question is it logical for us then budgeting going forward to assume that we should reduce the subsidy even more? Or are we just creating a setting in which our actual operating costs are going to be not paid in the current mill rate, but thrown into a negative fund balance for a subsequent year, so that you're asking for tomorrow's taxpayers to pay for what today's taxpayers really ought to be paying? And so I'm not ungrateful for the compromise figures that my chair has reached forward with in $1,125,000. I would have been inclined to budget not less than a subsidy of $1.5 million. And so that forms my next motion. It's a motion to amend the $1.125 million subsidy to Nathaniel Witherell to become a subsidy of 1.5. And at that, I do that knowing that I actually have an expectation that even with the new management and even free of COVID, I actually believe the facility will run a deficit of another $1 million besides that subsidy. That's my motion.
Your motion is to amend the
amend
1125 by $375,000 increase to 1.5 million, correct?
Yes, Madam Chairman, that's exactly my motion.
And I second the motion.
Okay, so do you have further comments? Or you?
No, I've made plenty of comment. I should leave my colleagues have a chance to speak.
Andy?
Thank you, Jeff. And I generally agree, we need to be honest about our budgeting. The numbers for Nathaniel Witherall have, well, the prospects have changed dramatically as we're emerging from the pandemic. Two things are happening. Well, so far this fiscal year, the facility is operating basically break even before funding from the town. And that's due to a combination of a couple things. There's been a slight recovery in the census so far this year. And there's also been a dramatic increase in reimbursement rates.
The current year capital projects. First of all, on capital generally, let me just mention that Mrs. Tarkington is proposing that we, as has been mentioned, that we use $5 million out of capital non-recurring to offset. Had we not done that, had we not used those funds, then I probably would have been making a motion to increase the capital tax levy, which means to pay a little more of our capital out of mill rate, out of tax dollars. I won't be making that motion because I think the $5 million being used out of capital non-recurring makes that not necessary. But I will return to that theme, I'm afraid, a year from now when we're doing guidelines again. I'm not sure I'll be on the budget committee at that point. I think I probably won't be. But anyway, somebody should be making that motion. Our capital non-recurring is, as Mr. Deuce had mentioned, is more than $11.3 million, which is a very high number. And that's what I think makes it possible for us to use $5 million out of it without feeling like we've left the capital non-recurring account to be too spare. But it should be mentioned that that is a subsidizing of the cash portion of our capital in a way that doesn't hit mill rate and that therefore is not really truly reflected to your taxpayers. And that's a little artificial, and as Mrs. Moriarty had mentioned, that's not something that you're going to be able to repeat year to year because the capital non-recurring account won't be there. You will have used it. But I do make a motion with regard to the total capital projects. A year ago, not quite a year ago, but a year ago last spring, last spring, that's a better way to say it. Last spring, we approved a budget. And the budget we approved also had a capital model, and that capital model had $94.5 roughly million being suggested as that would be the capital for the fiscal year 23. We're not seeing $94.5 million being proposed now. You're seeing $70 million being proposed now. The 94 million probably is a number that arises. Roland would know this better than anybody, I suppose. To a certain extent, one takes capital projects that are on the slate to be done, on the table to be done, and they weren't approved, so they get slid backward, and Roland probably puts them into the next available fiscal year within reason. Do I have that about right?
That's true. Because we don't really try to reallocate them into other years. We just, for convenience, we just move it all into the next fiscal year.
So the $94.5 million would have been an inappropriately and artificially large expectation of what's going to be approved in fiscal year 23. But 70 million seems a little thin to me. It was originally proposed by Mrs. Tarkington at 64 million, which I found just plain objectionable. I thought that that was less than fair. Again, it's a kind offer of compromise that Mrs. Tarkington offers at 70. I frankly would be more comfortable at $75 million as being more reflective of what we think we should be doing next spring. And so my next motion is to amend the $70 million figure of the total capital projects to read $75 million, and I so move.
I second the motion.
Do you have any further comments?
I've made plenty of
Sorry,
comment.
do you have
Let
any
others
further
speak.
comments,
Yeah,
Jeff? I'm sorry?
No, I'm sorry. Let others speak, yeah.
Is there any other comments here?
This is Andy Deuce. We actually did go through the total list of the rolled over projects and the new projects slated for fiscal 23. And we took out those that were clearly not wanted by the town and had no chance of being done. And we also took out projects that are meritorious but have little likelihood of being possible next fiscal year. And it seemed to fit close to the close to the 70 million that we have here in Exhibit 1. So I am comfortable with it and I support the number and will not support the motion.
So I went through a similar exercise in looking at all the projects that comprise the 94 million that's in our budget for fiscal '23. The number of projects that are $1 million or higher total $75 million by themselves. And it's some of those projects that may not occur. It's often the lower maintenance projects, lower cost maintenance projects that do remain in the budget. I think we're going to get requests that exceed the $70 million. I think that when we debate the budget, we really look at the capital projects on an individual project basis. We know that we believe there might be an impact from the ARP funding, both that will address both the next fiscal year and the years thereafter. However, where we are right now, we know that there are significant capital needs within the community, that the budget last year was at 94. And like Mr. Raymer, I am more comfortable with a number at 75.
So I'm not going to support this motion. I've already worked, compromised, whatever, but I would just like to comment that, as Andy said, we've each gone through separately and looked at the capital items. But more importantly, I think at this point in time, we have approximately $142 million of open capital projects, as Roland calls them. That's a total of 367 projects. Of that breakdown, approximately 89 million or 250 projects is in the town, and approximately 53 million or 117 projects in the BOE. Last year, when we looked at the projects, when we get into the February timeframe, I believe there were 130 capital projects. And and we added an extra consolidation day to that schedule. Mr. Raymer asked in this schedule that we could add another day also. So our schedule is expanding, but when I looked at the number of capital projects in the approximately $95 million that Mr. Raymer and Ms. Moriarty, Mr. Deuce have referred to, there's 248 projects. And there's a capacity of what our staff and our management can handle. And I think critical to this budget, and we certainly have it in the first paragraph under capital, is the prioritization of projects. In addition, I'll add that we will have the ARP program for capital projects. So I expect some of those projects may be moved into that program. That will run a parallel system. In addition, I expect, based on input already from Pete and Roland, that there'll be some projects, as in the current fiscal year 22, that have been moved from capital to operating because they really are operating projects, and Pete and Roland have already looked ahead to that kind of a, again, I guess, repositioning, we'll call it. So with that, no further comments. I'll take a vote. Mr. Raymer.
I'm voting yes on my motion.
Mr. Deuce.
No.
Ms. Moriarty.
Yes.
And Ms. Tarkington votes no. So that motion is 2-0 and has failed.
I have just a couple more items and then I'll be done, if that's all
Okay.
right. I had a question for Mr. Geiger. In the course of looking at the drafts, I noted that the amount that you're applying for debt service increased by almost $1 million between the first draft of Mrs. Tarkington and the current draft. I'm not sure if I understood what that was.
When we did the first draft, we assumed that in January we would go out, I believe, for $35 million. Since then, talking to Pete, he's going to keep it at $40 million. So that resulted in a
Slight increase.
$1 million increase.
Yeah, it's a little less, but almost $1 million, yeah. All right, thank you. I note again that the capital tax levy at 52 million is more or less the same figure as at 51 million and small change a year ago, and now it's rounded up, it's almost an additional million to 52 million. We had for years a discipline of increasing the capital tax levy by $3 million a year. In large measure, it was sort of to capture an inflation factor on the debt package that we're carrying all together. And I thought it was a good discipline. And I regret that we have drifted away from the discipline. This is not the first year that we've drifted away from the discipline. We've been away from it now for a few years. And I'd like to return to it again. I'm making no motion this year, because I think the compelling reason for that is largely offset by the use of the $5 million of capital non-recurring. But I do hope that the people who are sitting on the Budget Committee next year will propose a return of the discipline to increasing our capital tax levy each year. And then for my last remark, I think a 2.5% increase in mill rate is perfectly sound and appropriate, and so I fully support the proposed use of fund balance, in this case at $16.6 or $16.7 million to achieve that. I don't feel a compelling need to use more fund balance to buy it lower, and I don't feel a compelling need to use less fund balance and leave the rate go higher. The fund balance as it stands today is, as Mr. Dewis had pointed out, is slightly under $68.3 million, a very large number, and it's been an increasing number. It's perfectly appropriate that if we have effectively overtaxed our taxpayers in the last few years, which I guess is the implication of fund balance, that you taxed for a little more money than you needed, and so the funds were left there in fund balance, maybe it's appropriate that we at least I can't give the money back to the past taxpayers, but maybe there's a logic to our giving some relief to today's taxpayers rather than roll the full $68.3 million forward just for the sake of taxing at the full level of expense. And so I have no motion there. Those are all my remarks, and thank you for your patience in allowing me to speak as long as I spoke.
No, I think your comments, I think your comments are thoughtful, Jeff. I think a lot of time and effort has gone into this, a lot of compromise, by all involved. And, just a further comment on your tax levy comment. Also, moving projects from operating into capital also has an impact on that. And, this has been, we knew when we started last year, that it would be a multi-year program. We obviously, Roland and Pete identified the projects last year, and we'll be identifying more. I think that also means that there's less debt service. That program will, you'll feel the result of that in debt service. It's another way of looking at it, but I expect that probably I might be wrong, by the end of this fiscal year, we'll be back to a more normal capital being budgeted in capital and operating being budgeted in operating. So I wanted to make that comment. I think this is hopefully people understand this is a budget that really is trying to balance the needs of all. I think it's, we're delivering a budget that, per student is, probably the highest in the state. And everyone has been working together in terms of making sure that the town is delivering the services that people want, the balance between, our infrastructure improvements and recreation and all those great things that it made Greenwich so great. And I think it's also the fact that we've always invested in our infrastructure, invested in our schools, technology for the schools in advance, helped us get through COVID much more easily. We could, use passive recreation or school at home and have that technology available for the students, whatever it is. So are we ready to take a vote, or are we on our original motion, which was made by Mr. Raymer and seconded by Mr. Deuce? Okay, so you ready, Mr. Raymer?
I am. I would vote yay. I would vote yay.
And-
My microphone's off.
and
I would
Mr.
vote
Deuce?
yay.
Andy Deuce votes yes.
Ms. Moriarty?
I also vote yes, and Redondo, there is one Scrivener's error, which needs to be changed on Exhibit 5.
Is it, okay, do we stop the vote, or do we want to handle it?
We can identify it afterwards, I think.
Okay. Ms. Moriarty?
I vote in favor.
And Ms. Tarkington votes yes also. So that's a vote of 4-0-0. So I thank you all who've been it's a good team to work with. And, the work has only started. This is only the beginning. And then obviously, we send this off to the full BET for next Monday's meeting. So Leslie, you had a comment here?
Identify the Scrivener's error on
Well,
Exhibit.
wait a second, just let me get this
It's on
out.
Exhibit 5, the calendar. I think the date's adjusted, but a February date is in the January, under the January subheading. So it just the subheadings have to be moved.
Whoops, we'll fix that.
And we're missing an underline between March 10th and March 28th.
March 10th. Oh, yeah, it is missing. Thank you. We'll fix.
I thought that was an 18-day meeting.
So, with that, I mean, oh, no, we want to make it tough for everyone. Yeah, I see that. Thank you. Thank you very much. So, with that, do I have a motion to adjourn?
So moved.
Second. No.
There were no minutes in the packet. Yeah.
It's been seconded, Leslie.
Those in favor?
Aye.
Aye.
322. Thank you, Pete. Thank you, Roland.
Yeah.
Elaborate on something you were talking about. You were
Sure.
talking about the areas of compromise
Yes.
that were made. You mentioned
She-
the Witherall, you mentioned the Capitol, but what else there might have been that you felt was an area of compromise?
Yeah, there were several compromises. Inflation was called 200. Everything was originally at 2. That doesn't. The 10-year Witherall proposed subsidy to the 10-year Witherall at 750. 1.25. Correct. That wasn't where I was happy, but next, school lunch. She had proposed a subsidy. I hardly know you, you know?
Yes, I know,
I'm sorry, but I look forward to getting to know you better.
Oh, for a short
Yeah.
period.
Yeah, for a short
Several
period.
weeks.
Yeah, okay.
Couple more
Yeah,
months.
yeah. I appreciate your coming. I mean, take the responsibility.